you very much. I've written a speech. I'm not sure how well I can read it in what seems like a kind of nightclub setting, but I'll do my best. Well, I think most people here are here because they understand that the NHS is under threat, as never before, and a threat to its very existence as a public service. And across the whole of England, we're seeing NHS services being privatised. In fact, the most scandalous thing I read recently was a contract for nearly £1 billion for cancer care and for end-of-life care being put out to tender now in the north of England. So this is the sort of thing that we're seeing, more and more contracts being put out, and about 70% of them are being won by private corporations. And we know about the cuts, we know about the closures, and we know about the whole service being run down. Meanwhile, this government washes its hands of this, and that's partly because with the Health and Social Care Act, the government no longer, the Secretary of State for Health, no longer has a duty to provide a comprehensive healthcare service. You're seeing now people like Jeremy Hunt saying things like, it's got nothing to do with me, take it up with NHS England, as if they are no longer responsible for our health service. And the pro-government think tanks are floating the idea of user charges. It's starting to come up more and more. Reform, the King's Fund, other organisations. The government still denies that it's going to bring that in, but you know the direction of travel is towards people having to pay, people talking about paying for A&E, paying for the GP, paying for overnight care in hospital. This is, I think, what's going to happen if this government, if the Tories get re-elected. Just as they didn't tell you what they were going to do with the bringing in the Health and Social Care Act and the privatisation of the NHS before the last election, they're not telling you that what they plan to do if they get re-elected is to actually bring in a two-tier system where people will be expected to pay top up for their health care, and we'll be moving towards an insurance-based system. And the thing that worries me most is this, as a doctor, is this talk about reconfiguration, which is really a smokescreen for hospital closures. And when you hear reconfiguration, it sounds kind of sensible. Well, why can't you just reorganise things to modernise and update and just rearrange services to take account of changes in patterns of healthcare and illness? But that's not what's really happening. It's actually a hospital closure programme. It's a liquidation of our NHS assets across the country. Every single reconfiguration includes a significant net loss of beds. The capacity for the NHS to provide care is being shrunk before our eyes, and hospitals are being earmarked for demolition to be sold off, and especially in London for luxury flats seems to be the main purpose. They were going to try to sell 60% of Lewisham Hospital site to make money to pay off the debt of the neighbouring South London Healthcare Trust. How is this affecting London? In London there are 9 hospitals, either have just lost their A&E and maternity or under threat of losing it. 9 hospitals which will effectively close as district general hospitals. They're mainly in deprived areas of London, and they will mean that people living there will have much further to travel to access their health care. I was in Ealing and Southall yesterday campaigning. We went around 4 shopping centres. There was an amazing response actually from people who were very concerned about the NHS. But what strikes me is that that area, northwest London, is set to lose 4 out of 9 of its hospitals. Then we've got southwest London where St Helier Hospital is under threat. We've got northeast London where King George's Hospital is due to close in 2015, and the patients will all have to transfer to Queen's Hospital, which is a PFI hospital. It's a familiar story. The PFI hospital is saved because you can never close those PFI hospitals, but other hospitals are then closed to funnel patients into the PFI hospital. Queen's was built to handle 90,000 patients a year in its A&E, is currently handling 140,000. When King George's closes, there are no plans to increase its capacity. We see what happened when Chase Farm Hospital has closed. It's putting terrible pressure on Barnet Hospital. We're hearing stories now of ambulances taking sometimes 2 hours to pick up a seriously ill patient. Why? Because the ambulances are tied up, queuing outside hospitals, unable to deposit their patients, to transfer their patients Patients are backing up in A&E, there are no beds for them. Patients can't be discharged from hospital because of 20% cuts in social services. So there's a crisis at every level. And now we're hearing about GP practices. I'm a GP, and for the first time in my lifetime of work, GPs have gone up and had them trials and tribulations, and their good days and their bad days, but we always thought there would be GP practices there. We're hearing of really good practices in London under threat of closure because of underfunding. I could go on, but this is all about, I think, running down our NHS and softening up public opinion for the solution. What's the solution? Let's privatise it because of so-called private sector efficiencies, and let's start charging for it, because that's put as the only way to really save our NHS. We need to counter all those arguments, and Clive has already, in his speech, talked about some of how we counter it. The NHS is not unsustainable. It is underfunded. We could afford to spend much more on our NHS and still be behind 14 comparable Western economies in how much we spend on our healthcare. Privatisation costs more, not less, because the market costs billions to manage. It's a false economy to cut 6,000 nursing jobs and then complain that you can't have the quality. To have quality care, we need staff who are supported, valued, properly paid, and sufficient numbers. I think most people in this room know most of what I'm saying, and the question is, how do we go beyond this room, go out into the community? When you talk to people and explain to them what's happening, they are as concerned as we are, but mostly they don't know. The media has not covered this issue in any depth, and the main parties are silent. I think the Labour Party has been especially quiet on this issue. Andy Burnham says some good things, but we don't know to what extent he actually represents the Labour leadership, and to what extent he will actually even be the Secretary of State for Health if Labour got re-elected. So we need to hear it from the Labour Party. We need them to accept that they need to reverse the cuts and fund the NHS properly. They need to deal with the PFI issue, and they need to really back up what they're saying about ending privatisation. They're saying they want the NHS to be the preferred provider, but that's still within a market system. It's the market system which is the problem, and they need to commit to ending that market system. What the National Health Action Party, or just a small party, what impact can you hope to have? I think we have to be honest, we don't think we're ever going to be a party of government. I mean, it'd be great if we were, but it's not realistic. We are a political pressure group using the electoral process as a way of actually reaching out to more people. We have much more access to the media by standing in elections. Elections are a time when people are more interested, or there are more articles, there's more stuff around, there's more stuff in the radio and the television about political issues. So we want to use that sort of increased alertness and awareness to actually get some messages, very powerful messages across about the NHS. If we got a big vote though, it would actually be a kind of referendum on the NHS in London. It would show the main parties that people are beginning to wake up to what's happening and really care about the NHS. The Tories have gone quiet on the NHS. I don't know if you've noticed that, but Linton Crosby, who's their attack dog that they've brought in from Australia, has said, look, if you talk about the NHS, it's always bad for the Tory party, so stay quiet. We're even getting a charm offensive. We're getting Jeremy Hunt sending nice letters round to health workers saying how much he loves them and how much he values them. There was a recent one in the front page of one of the papers that we get as GPs directed to the ambulance service. Did you know that? He really loves you. So, so they're going quiet on it. Labour is quiet on some of the really important issues. It's not speaking loudly and boldly and strongly enough. It wants to avoid the topic. So we are the people that are going to bring this up and make it an election issue. If we get a good vote now in the Euro elections, it sets us up really well towards the general election. If we get someone elected, which is not impossible, as Clive said, I think that would be a game changer. I think that would change the political landscape. It would show that this is a number one issue for the people. London especially. So, UKIP are doing well. Apparently they're on 30% because to some extent they're a protest vote. People are fed up with the main parties. They're looking around. We don't want people just to waste their vote on some kind of meaningless protest. We want people to vote for us in a positive way, not just to protest, but to vote for something positive that they really believe in. And in the Euro elections, it's proportional representation, no vote is wasted, every vote counts. So that's the message we want to get out. I spent the whole of yesterday and Friday, and loads of other people have been spending time out in the street talking to people. It'd be lovely if everybody here takes a pile of leaflets when they go and thinks about doing their local school, their local station, or their local hospital, or their workplace, and starts engaging with people about this issue. Thank you.